Howdy everyone, Matt and Mateo here, coming at you with another orthopedic special test. This one is for the hip. It is the hip adductor squeeze test. This test is used to see if there is an issue going on with the hip adductor, so it's pretty straightforward on it. Now, I couldn't find like the exact day, when they published the study that said oh, this is a good test for it anyway, but it's pretty straightforward. So there are three parts to this test. So somebody comes in and they're saying they got pain on the inside of the leg, and you want to see, is it a hip adductor injury? You have them laying down. Mateo really likes the ones that he gets to lay down on, but you have the person laying down on their back. You can use your fist or something kind of hard. You place it between their knees here, so with them here, and just tell them to squeeze. If this produces pain, it is a positive. So if it doesn't produce pain, you have them bend their knees, and so their hips are about 45 degrees. Same thing. You place the hand in between and have them squeeze. Again, produces pain, well, it's a positive. And if that's not, you bring them all the way up here and hold them in 90 degrees of hip abduction or hip flexion, and do the same thing, and they squeeze. And if it causes pain, it's a positive. I mean, it's pretty straightforward. It makes sense. If there is a soft tissue injury to the muscle, activating that muscle is going to cause pain. Now, there's no studies about the reliability, validity, sensitivity, specificity of this test, but they did look at one study to see which of those three positions is the most optimal, and they found you get the highest activation at 45 degrees there. So that's with that being said. There's also some research that they've used this test to look at hip adductor strength overall in elite soccer or football players, and they were saying that if the players had higher strength numbers in their hip adductors, they had lower incidence of injuries. So they said this could be a good thing to assess in people who do these very high impact, they're changing direction. If you've ever watched a soccer game, how they're changing, because in the study they said most of these injuries came when they were playing in their game, so working at that higher level. So that is the hip adductor squeeze test. What do you think about it? Do you utilize this in your practice? Do you think it's beneficial? Do you think we need to do some more research to show that this test is reliable or whatnot? But there you go. And with that being said, as always, take care of yourself, take care of your patients. We will see you next time.